name is Mrs Rita Ngozi Afaku. I came in on emergency from Port Harcourt, from Pringle Hospital, Port Harcourt. They were to operate me in Port Harcourt, but my children rejected. I came on emergency. I didn't know when they took me to this. I was gone until a few days. When I woke up, I saw myself in the hospital with Dr. Nico and Arinze, one of the best doctors. I could not breathe. It seems my breathing is ceasing. Anything I eat comes out, and in fact, everywhere was hooking me. I couldn't even breathe well. They said they went for X-ray. It's nothing because I was not. No, I don't know what went on. It's my children who know what went on. But when I woke up, I saw Dr. Nicholas and Arinze. They are my doctors. I know that God will bless them because they are one of the best doctors. They didn't leave me with the nurses. So my children now are booked that here is where I'll be coming. Instead of, I have an hospital in Lagos here, but I don't think that I've received the treatment I received here. I'm coming September again for the checkup. Tube was put in my distance, whereby water or something like that, something go off, something flushing and out from inside the tube. Every morning they flush it out, they remove the distance. That is what I know until after 6 weeks. They have to re-operate me because they say that if they operate me there, I might die because I was not myself. I like their patience. You understand me? Because had it been as I came, operation, I could have gone. They checked and said, no, this woman will not take it. So I have to stay 6 weeks. They now took me to theater, operated me, and put another this in there, pipe. I know that they remove Gall Bladder. That is what I know. They show me the stones when they brought it. They show my children 2 stones. I was in the hospital for a week, maybe a week and some days after my surgery.
My name is Dr. Arinze. I am the consultant general laparoscopic surgeon at Evercare Hospital Lekki, Lagos, Nigeria. I met Mrs. Rita Afaku about 2 months ago when she first presented with us with chronic upper abdominal pain. She was quite sick and had to be admitted as an emergency. After adequate resuscitation with control of the infections that she had, imaging revealed that she had a complex gallbladder disease characterized by chronic cholecystitis and some stones within the gallbladder. These stones have been there for quite a while and was already causing a lot of problems. We managed that conservatively at the first instance, including putting a small tube through the liver to the gallbladder to help us to drain some of the bile that has been retained there. When her conditions are improved, we took her to theater and then making an incision over the upper abdomen, we were able to get all the stones out as well as removed all the diseased gallbladder.
Early last month, I was discharged, so I've been coming from house, but now the wound and everything is healed. And then each time why I like those 2 doctors, each time they want to dress it, you see them, one of them must be there to check what is happening. So when they checked and saw that everything is healed, they now say that, Mommy, you can go, and I love them. The way they treat me, Nico and Arinze, like I'm their mother. They call me Mommy, this. If I'm annoyed, you see them making me to be happy with the nurses.
She made a remarkable recovery and was discharged in record time within 6 days of admission. She has continued to improve clinically and has been followed up in the clinic on a regular basis. She has not demonstrated any acute, chronic, or delayed complications from the procedure that has been done.
Most of my friends in Port Harcourt, I will advise them. I will give them the address of this place because some of them have some sickness that they want to go to abroad. My dear, if not this, I could have been flying abroad. But my children, who God will bless, all my children, God will bless, and they brought me here.
And we are glad and thankful that she was able to trust us to offer her the best care in Nigeria, and she didn't need to travel out of the country to have her conditions treated.